There's a lot to do here to stay healthy and fit. We have access to community centers and associations that offer free fitness classes and organized sports. But what if you get sick or injured, and how do you find a doctor? In this video, we'll look at health and nutrition in the city. If you're in need of immediate healthcare treatment, hospitals such as the Health Science Center or Misericordia Hospital are easy access and are both located in the core of Winnipeg. If you are sick or ill, you may want to use a local walk-in clinic, which saves time, and all you need is your health card or activity card. It's a good idea to apply for a family physician who can monitor your health, opposed to going through different doctors.
My name is Rosalie Uskan. I'm a patient navigator for Assembly of Manitoba Chiefs, and serve Aboriginal people when they come out of the hospitals or when the doctor requires them to come to the city for medical relocation. We get all kinds of referrals, like it could be from the nursing stations or it could be from the hospital, directly from the social workers that are having trouble dealing with the clients right in the hospital. I translate where I can, and if I don't have the language that they need, there's interpreters available through the Winnipeg Regional Health Authority that we have a partnership with regarding our Patient Advocate Unit program here at AMC. In today's world, a lot of young people are forgetting their language, and for me, it's important to keep your language, and that's what I do. I do interpreting in Ojibwe, and I do a little bit of Cree and Ojibwe, and that's how I maintain my relationship with my clients that I serve.
Hi, my name is Jennifer Ledoux. I'm the First Nation Disability Transition Counselor here at the Eagle Urban Transition Center. I originally hail from Duck Bay, Manitoba. One's mental health is not only about physical, but it's about spiritual, emotional, and just being able to stay focused and being able to deal with life's challenges. When you're transitioning into the city of Winnipeg, it can bring about feelings of loneliness, sadness, excitement, joy, various feelings that can contribute to one's mental health. There are various resources that can assist you with those feelings and talking and coping strategies, whether it be through resources here at the Eagle Urban Transition Center or other various resources here in the city of Winnipeg. Here are a few tips for maintaining a positive mental health. Talk about or express your feelings. Exercise regularly. Eat healthy meals, get enough sleep, spend time with friends and loved ones, develop new skills, relax and enjoy your hobbies, set realistic goals, talk to a doctor or a health professional. Sometimes individuals are faced with drug and alcohol addiction issues. When they move into the city, that doesn't disappear. Sometimes it gets a little bit more exacerbated because of the conditions and because of the feelings of, again, being overwhelmed and frustrated. If you need assistance with dealing with an addiction issue, there are various resources here in the city that are available to help you. The Addictions Foundations of Manitoba at 1041 Portage Avenue, phone 204-944-6200, and Addictions Foundations of Manitoba for Youth Community-Based Services is located at 200 Osborne Street in Winnipeg. Phone 204-944-6237. If at any time you feel that you need more information, whether it be for the mental health or the addictions issue, you can always come to the Eagle Urban Transition Center located at 275 Portage Avenue, and we'd be more than happy to provide you with those additional resources.
Hi, I'm Darlene Hall. I'm a Métis, originally from Nepal, Manitoba. I've been in the city of Winnipeg since 1983, and I am currently the Executive Director of the Aboriginal Health and Wellness Centre. The Aboriginal Health and Wellness Centre is located in the old CP Rail building that is now called the Aboriginal Centre of Winnipeg, and it's on 181 Higgins. And the Aboriginal Health and Wellness Centre provides a wide range of both primary care and social support programs for the urban Aboriginal community. And one of the things that we do see coming in, especially with youth that aren't from the city, is diet. It makes a big difference. A lot of times they haven't been exposed to healthy foods, a lot of junk food, and things like that. So really, diet and exercise are really important. Unfortunately, STDs are rampant out there, and our youth are very vulnerable. So we have a lot of programs in the clinic geared towards those types of issues with the youth, so that they want to call up and talk to one of our nurses about anything that may be bothering them in regard to their sexual health. They're available. It is critical that as our young people, that they are taking care of their health, because if they don't take care of themselves now, today, 50 years from now, they're going to be suffering from a lot of chronic diseases that with proper primary care, exercise, good diets, and not a lot of bad habits, they will be healthier for their children and for the next generation coming up.
Good health depends on healthy eating. It's not as expensive as you may think. And you can save a lot of money by going to some of the larger grocery stores opposed to eating takeout food. There may be times you don't have the funds to eat right. That is why it is good to remember the resources. For example, emergency food services such as Winnipeg Harvest.
My name is Morgan Thomas. I'm the referrals coordinator here at Winnipeg Harvest. Winnipeg Harvest is a food reclamation and redistribution center. So what we do is we currently help about 64,000 people throughout the province of Manitoba get food and other resources. Using the food bank is about budgeting. So it helps you out a little bit. It's not like doing a full grocery shop. It just helps you for about 2.5 days, 5 days if you use it twice a month. We believe in a no strings attached philosophy to food banking. So what we do is we ask for the Manitoba Medical Cards registry number. It's a free form of ID. It typically shows family size, and we work our referral process off that number. We book appointments for people to go to community food banks. People will take their card to the food bank, show them their card, show them their family size, and receive food based on that.
There's a lot of food choices here in the city, but if you're craving Nietzsche Foods, you can come here to Nietzsche Foods. They provide traditional foods such as moose meat, pickerel, and even more. Hope you found some good tips in this video.
I just don't see why they don't want to let me be. All of my life I've just been trying to be free. I live